Chuck Hofacre. I'm a professor and director of clinical services at the University of Georgia's College of Veterinary Medicine. My area especially is clinical medicine for poultry medicine, and then also foodborne illness and intestinal diseases have been the areas I've done the most research in. The food supply in general in the United States is the safest food supply in the world. We have less people get sick and have any kind of diseases associated with the food they eat in the United States than anywhere else in the world. It's illegal to put hormones in chickens. If somebody did, they'd go to jail. Antibiotic usage is extremely highly regulated in the United States, and it's going to become even more so regulated in January of 2017. A veterinarian will have to be involved in the decision to use an antibiotic in a poultry, in pigs, and cattle. They'll have to write a prescription. It won't be any different than you needing an antibiotic for a sinus infection and going to the doctor. So that's going to make it even more, it should make consumers feel even more confident that their food is safe. They don't need to worry about their children picking up any antibiotic-resistant bacteria from eating chicken in the United States. A veterinarian or a farmer can't just go out and grab a drug and use it. It has to be exactly what's been approved by the Food and Drug Administration. Outside the United States, that's very, very different. But in the U.S., it's very highly regulated. We have many less antibiotics approved in the U.S. than anywhere else in the world. Veterinarians, almost every chicken company in the United States has a veterinarian or a consulting veterinarian that they get advice from. Most of the larger companies have their own veterinary staff. Those veterinarians their primary role is to prevent disease. A poultry veterinarian is like a public health medical doctor. They're looking at that whole big city and making sure that everybody in that city stays healthy. And that's what a poultry veterinarian does through either vaccination to prevent diseases or through the antibiotic treatment. To help consumers feel more confident that veterinarians are being consulted, the Food and Drug Administration changed the regulations on the use of antibiotics in food animals. And that will begin in January of 2017. And that will require that any antibiotic used in the feed or in the drinking water of a food animal has had a veterinarian sign either prescription for water or what's called a veterinary feed directive or a VFD, which is like a prescription for an antibiotic to be put in the feed. So that oversight's really always been there in the poultry industry. It's just now codified in a regulation where a veterinarian has to put their name on the line now, rather than just saying, yes, go ahead, this flock is sick, they need to be treated. They have to write a prescription for that to happen. There's a lot of misinformation about antibiotic resistance, and a lot of the concern that the people that are thinking that we shouldn't be using antibiotics in food animals are scaring the consumer to think that there's antibiotics in my meat that I'm buying. And there's not. The U.S. Department of Agriculture and the Food and Drug Administration have strict guidelines for the withdrawal of those antibiotics prior to slaughter. They know exactly when the bird's system metabolizes and clears those antibiotics. So there's not any risk of antibiotic in your meat. The second big concern that some of these consumer groups have scared the consumers with is the antibiotic resistance. I hate this term, but you hear people talking about these superbugs. There's no such thing as a superbug. There's bacteria that become resistant to antibiotics. That's a natural process. There are antibiotic resistant genes in bacteria that have been found in glaciers at the bottom of a glacier tens of thousands of years ago. Isolate bacteria that have the same resistance genes that the bacteria do today. The bacteria that the CDC is most concerned about, those ones that do get labeled the superbugs, are use the big terms: vancomycin resistant, enterococcus, methicillin resistant, Staph aureus. These bacteria that can cause fatal disease in people, they've not been shown to ever originate out of the animal population, whether it's cows, pigs, chickens, turkeys. Those are hospital acquired. And so the vast majority of these superbugs are hospital acquired, and the human medical community recognizes that. And that's the reason you also see, and especially lately, I've been really pleased to see some of the reports coming out of different associations of human MDs that, hey, we do link a lot of the antibiotic resistance to what we're doing as MDs. And we do need to help educate consumers to not ask for antibiotics, and educate MDs to not give antibiotics unless they're absolutely certain it's a bacterial infection. All meat is antibiotic free. Has it been reared? Have the birds been reared without antibiotics ever being used in their life? That's the difference. The struggle, so I don't know how you can educate consumers, and that's the struggle, is how do you help people to understand that there really isn't a difference in safety and wholesomeness between this chicken that doesn't have that antibiotic-free label and this chicken that does. You know, the gluten-free, I understand that, because there are certain people that are gluten intolerant. And so it is important for the consumer who is gluten intolerant to know that whatever they're buying doesn't have any gluten. I think the unfortunate thing is that many people who are not gluten intolerant think that's a healthier product, in the same way that consumers think that antibiotic-free is a healthier product, or that cage-free chicken eggs came from chickens that those eggs must be healthier. Hormones have nothing to do with the fact that chickens are growing bigger today. It really goes back to the consumer. The consumer wants more chicken to eat. They really like white meat, and they like a particular portion size of white meat in the United States especially. And so the poultry industry is going to meet that demand. And when I say the poultry industry, it goes all the way back to the breeding programs. And so it just through traditional selection of the biggest father and the biggest mother, they mate to make the biggest broiler chicken, and you do that for 30 or 40 or 50 years, and you pretty soon develop a chicken that grows at a faster rate to get to a bigger size, and it's just all through just selection. If you look at basketball players, if an NBA player married a woman's NBA player that are very tall, their children are probably going to be very tall. And we do the same thing with chickens. We select them for size. I'm really proud of the U.S. regulators that they have not done like the European Union. European Union came in and said, we're banning all antibiotics. You can't use them other than to treat disease. Well, in the U.S., they said, you can use them, and if you want to have antibiotic free, then you can choose to do that as a marketing. And so if consumers, and it's really, in my opinion, it's not being driven by consumers. It's being driven by a lot of it, the quick service restaurants like the Chick-fil-A's, the McDonald's. Those companies are doing that, in my opinion, as a way of marketing. And so if I owned a chicken company, I would say, look, this is a very good niche market, premium price. Why wouldn't I want to play in that and sell product into that? And so I think I don't blame broiler companies or turkey companies in looking at that as a market that they can sell into. What's troublesome is all the confusion that surrounds all the different names that all the different companies come up with for their particular brand of antibiotic free. As far as I know, there is no strict definition for what the label should look like. And that's why there's so much confusion for consumers, because every one of the companies has their own, they want to try to brand themselves so that they stand out, I think. So they have, no antibiotics ever, or antibiotic free, or, all these different labels. If we go back a little bit and talk about some of the uses of antibiotics in poultry. So they're used primarily to prevent diseases. And even the growth promoting antibiotics, they were approved by the Food and Drug Administration because they improved the bird's growth rate and feed efficiency, but they're actually preventing a subclinical disease called necrotic enteritis. And that subclinical disease occurs very, very regularly in companies that are antibiotic free. So those animals are going to have intestinal disease, and once it gets to a certain point where it's severe disease, then they'll become so sick they may die, and at that point they should be treated with antibiotics. They shouldn't be just left to be sick. If one or two dies, if a few die, then that's an indication that there's many more that are sick. I serve on the American Humane Association's Welfare Advisory Board, and one of the requirements is if you're an antibiotic-free company and you have birds that become sick and you don't treat them, that's inhumane, and you can't have the American Humane Association's stamp of approval on your welfare program. If I work with a company that is antibiotic free, one of the things that I tell them is that we will try alternative treatments. If a flock becomes sick, we'll try some of these alternative treatments in the drinking water to help the bird's intestines recover and to fight off that bacterial infection with a natural product rather than an antibiotic. But if the level of sickness gets to a certain point, then in my opinion, and I will not work with any company that doesn't do this, they must treat those animals with an antibiotic. Though that flock of chickens that's been treated with antibiotics can no longer have the label of antibiotic free. They go into the traditional chicken market. And so any flock that gets sick enough, in my opinion, must be treated with an antibiotic. I took an oath to prevent animal suffering, and I will not abide by any chicken or turkey company that doesn't treat a sick flock with an antibiotic, and they know that it'll stop that animal suffering. When a company chooses to grow chickens without antibiotics, the antibiotics are there to prevent subclinical intestinal disease. That subclinical intestinal disease is triggered by a protozoan that's found in every chicken house in the world. And so every chicken house in the world has the potential to develop subclinical intestinal disease. And that's what the growth promoting antibiotics did, was prevent that disease. So if you choose to sell or to grow and then sell in the antibiotic free market, you are not using something that could prevent that subclinical intestinal disease. So there is greater risk of those birds becoming sick, and a certain percentage of them getting so sick they die. So it's not uncommon to have slightly higher death rate on those farms that are antibiotic free, on a group of farms that are antibiotic free versus a group of farms that are on a routine antibiotic usage to prevent that disease. One of the things that we use the antibiotic growth promotants for is to improve birds' feed efficiency. So feed efficiency means the amount of corn or grain needed to get a pound of chicken meat. And that, for a very easy rule of thumb, it's about 2 to 1. 2 pounds of grain for a pound of chicken meat. The antibiotic growth promotants have been used because that makes it a little bit less than 2 to 1. So we use less grain, less corn, less soybeans to produce that pound of chicken meat. And so antibiotic free means that your feed efficiency, and you're going to use more grain to produce that pound of meat. Well, that grain that's not converted into chicken meat goes somewhere. It goes into the chicken poop. And so there is more waste that then needs to be disposed of. So now we're using more land to grow corn and soybeans to feed chickens. That corn and soybeans or that land could be used for something else to produce human food. And we also have more waste that we have to dispose of. So the environmental impact of antibiotic-free or organic production is that we will probably have more waste and we'll have less efficient animals, and so that means we'll have to utilize more of the grain that could go to feed people to produce chicken meat. In 30-some years being a poultry veterinarian, I've learned that the poultry industry and the poultry veterinary community is very adaptive to change. If the consumers continue to request antibiotic free and that market grows, we'll find ways that we can maybe not be as successful as use of antibiotics, but prevent or reduce the pain, the suffering, the mortality, the death of chickens if we don't use antibiotics. It's a shame that consumers are being misled to thinking that antibiotic-free is a much healthier product. But if that's what the consumer wants, I don't see fighting them to try to convince them, no, you don't want that. If you're willing to pay a higher premium price, then I think those companies that are willing to produce that antibiotic-free, then that's fine. We'll work with them to try to help keep those birds as healthy as possible. I just buy the cheapest brand. I don't worry about all that stuff.